love to meditate once in a while, and meditation is proven beneficial in treating several health issues. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. A short mindfulness practice can improve biomarkers of stress and inflammation. A growing body of evidence suggests that mindfulness meditation may have positive psychological and health effects in both clinical and non-clinical populations. A recent study has added further value by highlighting the positive impact of mindfulness practice on biomarkers of stress and inflammation in promoting the psychological well-being through a decrease in perceived stress and anxiety levels and an increase in the awareness programs. The study that we're talking about were published in the Psychoneuroendocrinology concluded that a mindfulness retreat may be effective in improving the physical as well as the mental health. Saffron may modulate inflammatory pathways of diabetes and reduce diabetic complications. Diabetes is one of the major medical problems which can lead to damage of cells or organs in various parts of the body. Its complications are reported from time to time, and a recent study published in the Diabetes and Metabolic Syndrome Clinical Research and Reviews Journal suggests that saffron can modulate the inflammatory pathways in patients with diabetes, and that its mechanism in turn may help to halt the progression of diabetes and its related complications. Selection of cast and wrought-wire clasps for removable partial dentures, a guideline release. What are dentures? Dentures usually consists of replacement of teeth, and they are usually attached to pink or gum-colored plastic bases. A partial denture may have a metal framework and clasps that will connect to your teeth, or they can even have other types of connectors that are more natural looking. A recent set of guidelines have suggested that combinations of clasp material and undercuts would exert the maximum retentive force without deformation were found to be the most effective and published in the International Dental Journal. Renal is a novel biomarker for diagnosing renal injury due to blunt renal trauma. Kidneys are the most frequent injured organs in the genitourinary system, but there is no specific biological marker for its trauma per se. In a study published in the Journal of Pediatric Urology, the researchers have suggested that renalase levels might be a useful biomarker for the diagnosis of renal injury due to blunt renal trauma. The authors have concluded a definitive diagnosis of traumatic renal injury in children is made with contrast-enhanced computed tomography, and it is reported for the first time that renalase levels may be useful as a biomarker for the diagnosis of renal injury due to blunt renal trauma. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.